Hi, I'm Angela Preston. I'm going to be speaking on communicable diseases. That's going to include the immunizations and also common viruses that we see in the pediatric population. My lecture will be March 18th, and that's going to be at UT Tyler for the Family Health course. A huge section of this topic needs to be on education. And I just want to emphasize that to you nurses and nursing students, how vital it is that we educate our families, because we don't see these children in the hospital very often, and not in the clinic either. A lot of it would involve home care and choices that a parent has made before they arrive to the clinic, or if they're at the clinic for a visit, you can educate them and then they can think on it and come back and decide if they want to get that shot or whatnot. So jumping right in, immunizations for children. We have Hep B, DTaP, polio, Hib, the pneumococcal, rotavirus, MMR, varicella, Hep A, the flu, and then meningococcal. So from a school nurse standpoint, all of those are required at kindergarten entry except for the flu and the meningococcal. The Hib and the Haemophilus influenza type B and the pneumococcal are actually daycare vaccinations. Once they hit age 5, they don't administer those anymore. Those two are more for respiratory illnesses. They kind of, at one time, the Haemophilus type B was the leading cause of meningitis in young children, and that's really helped decrease that. But there's 4 doses of each of those given. Just touching on each of those, the Hep B, that's the one given to newborns right at birth. If you have parental consent, that needs to be obtained by the L&D nurse before delivery usually. If it's not, you need to make sure it was given. Consent was given before the vaccine. And then the DTaP, that's the one that has pertussis, and it's really helped decrease the incidence of pertussis. It's important not only for our pediatric population to get this, but also our pregnant mothers and families or immediate caregivers of those who are going to have a newborn, because the newborn can't get that shot until at least 2 months, and pertussis can send a baby into the hospital. We really want to prevent hospitalizations as much as we can. The Haemophilus type B, we went over that. The rotavirus, that's an oral dose. That's not a shot, but I really recommend that to be given because that protects against dehydration, GI illnesses, diarrhea, those things that can affect our young infants. They can take a drastic toll when they're not eating. That dehydration, you need to remember, that's a huge problem for that population. The only thing you wouldn't want to give that if they have a history of a GI disorder already or a history of intussusception. Polio, that's usually given combined with DTaP. There's the IPV and the OPV. The OPV means oral polio. The IPV means inactivated. The OPV really isn't given anymore. It used to cause paralysis in immunodeficient children. So that's one reason it's kind of been weaned out. And then MMR and varicella, they're commonly given together. And that is a weekend vaccination. So that means that it can produce mild symptoms. So you want to educate those families before that's given. The child may experience a mild fever after being given. They may want to prophylactically administer Tylenol or ibuprofen. And in this instance, you need to make sure and remind them that they don't give aspirin. You'd be amazed I come across a lot of parents working in the school system and how many don't know not to give aspirin to their children. And it's recommended that children under 18 do not receive this for the risk of Reye syndrome. And meningococcal, that's not given till 7th grade. It's not required till 7th grade. It can be given younger, but you really don't see that on that schedule, that vaccination schedule put out by the CDC for children under 5. And then also you need that for college, which probably most of you are aware. So moving on. Okay, so just some general considerations with these immunizations. You want to let them know if, it could possibly cause soreness at the injection site or maybe some redness. And on that, you can just put a warm compress. If they're experiencing pain, they may want to administer Tylenol, ibuprofen. And you want to make sure they're doing the appropriate doses, following the label guidelines, or they could even do it by weight. Especially with those infants under 2, a lot of those box guidelines say, well, consult your doctor. So you want to make sure that they do know what the actual amounts are supposed to be. Whenever you do go to give the medication, you need to make sure that consent was obtained. That's the physician's responsibility to obtain consent, but it's the nurse's responsibility to make sure that it was obtained and that the patient is fully educated and aware of the purpose of the vaccination and the possible side effects. If there was a reportable side effect that happened, you would need to notify the health department and document that lot number, site, the manufacturer, whenever after you give that dose. And some of you may go to work in a clinic. More often than not, RNs are really in the hospital setting. And if you do happen to give an immunization in the hospital, you not only need to chart it in your records, your system records, but also on MTRAC, which is the Texas Online Registration Immunization Registry. So if a doctor's wanting to know, are they up to date on immunizations and you're in the hospital and you don't really know what to do, you want to check MTRAC. So that's just some information on that. And also, that being said, that does get deleted after their 18th birthday unless they give consent for it to be continued. So we would just want to let our seniors or our patients approaching 18, before they turn 18, that will happen. Now, and one last vaccine I didn't really talk about was the HPV. It's the human papillomavirus. Some of you may be familiar with this because there's Gardasil out now, which is given to girls as young as 9 and also to boys around that age. It's 3 doses. There are side effects of nausea, vomiting, dizziness, fainting. You have to check for pregnancy prior to administration. And the state has considered requiring it for school, but it prevents an STI. So there's some debate about it. Is it ethical? Should we require this of that young of children? How does that make them feel checking for pregnancy? So that's something you just want to be sensitive when you bring this subject up with your families and parents. Okay, so types of immunity. There are several different types of immunity. When we're talking about immunizations, we're talking about active vaccine-induced immunity. So there's active and passive. Active usually produces a permanent or long-lasting effect. Passive is usually a few weeks, maybe a few months. So under active, we have natural and vaccine-induced. Natural is you get a cold, you're sick, and then you can't get that exact specific virus cold anymore because you have natural active immunity to it. Well, the active vaccine-induced would be you get a vaccination and you've been exposed to a weakened form of the virus, and so now you get immunity from it. So you don't actually have to experience this full symptoms of that virus. Passive, just to go over it, there's natural passive immunity, which would be things like a pregnant mother and her fetus or a nursing mother and her baby. And that's one of the huge benefits of breastfeeding is those immunoglobulins are passed through the breast milk. And that provides natural passive immunity. The infant's not having to do anything. The mother's just providing it to them. And it's just a natural thing that happens. The immunoglobulins, the passive immunity through immunoglobulins, that would be something such as when a Hep B positive antigen mother delivers a baby, and in order to prevent chronic hepatitis V virus in that infant, they need to administer that HBIG, that hepatitis B immunoglobulin, within the first 12 hours of life. So if you are a labor nurse or a nursery nurse and you see that the mother did not have her 3rd trimester test, which would test for that, you need to go ahead and check on that infant and check with the doctor and let them know to see if they need that HBIG. Because again, that would be something the doctor would order. But it needs to be done as soon as possible, because that can cause that that infant to be a chronic hepatitis B virus carrier, and it may not produce any symptoms for most of their lives, but later on in life, it's been seen to cause hepatocellular carcinoma.